This is Our Side of Addiction, the podcast. I'm Amanda Bork. Let's go. Well, look who's here. Look who decided to join. Yeah, you. I am talking to you. Beautiful to see you. You look amazing. Let's get into our topic. Enough of that small talk. Today, we are going to be opening up our channels of communication and understanding around addiction treatment options. Detox, rehab, outpatient, what does that mean? What's happening? As the loved ones of addicts, we can often feel disconnected, unwelcome, or outside the loop as it pertains to our loved ones' recovery. And that can feel disheartening. It can sometimes feel like a form of rejection. And it can also feel as though it's by design, where you're not supposed to know what's going on, whatever the design is. I want us to start opening up to this so that we can understand really what's happening. And once we understand that, then we can be our most supportive. I don't know why it's designed so strictly. I do and I don't, okay? Part of me doesn't understand why it's so separate, the family from the recovery process, because family is a huge factor in someone's addiction and whether or not they're going to get clean. It's just the matter of it. Huge impact from the family. The side of me that understands why it's so separate realizes that an addict's journey is very different and separate from the family member's journey. While we do have to go through these experiences and journeys separately, we also have to come together. If we're going to have relationships with each other, if there's going to be a future for us, don't you think we have to overlap at some point? It's a little bit difficult. I can see both sides, but I really feel like there's not enough light shed on the family members, the loved ones. In general, the thought of treatment can sometimes be overwhelming. It can be confusing. It can also feel urgent. And there's this cycle of feeling hopeful, but also getting your heart broken and being terrified, all at the same time or one right after another in some sort of sequence. We don't always know all of the options. Maybe we're afraid to advocate for one or another. Do you even know that there's more than one option? And you've tried treatment before, or they have, and it didn't work. Or they say it didn't work. Really, if it didn't work, they didn't apply what they learned in treatment. But that's something you'll commonly hear addicts say. It didn't work. I know what they're going to say. I already know what to do. It's just a way for them to try to weasel out of facing treatment. And treatment itself, these decisions, they can have medical aspects, not always. Where medical meaning medically assisted detox to help them ease out of that experience, but to also help them maximize their time, because if they're ill and in the fetal position, sick for 2 weeks, you lost 2 weeks, which is vital amount of time in treatment. That in itself can be a difficult decision or thought, but it's also emotional. It impacts our relationships. There are financial burdens, and there can be a great deal of disappointment in that process. Just so you know, there's not a perfect option, and we're not going to talk about all of the options today, but having a greater understanding of what's available ensures that we can be the most supportive. We can go and do our research, and we can help encourage personal responsibility and personal action. As we are all very individual and unique little stars, not everything is going to work for everyone. And there could be elements of the 12-step that people like and elements that they absolutely hate. It's not just a one-size-fits-all. We really encourage, in that, at least I do, encourage for addicts to explore some options. And there are ways that we can do that with zero resources. Exploring options and testing out to see what aligns and what doesn't, what connects with us and what doesn't. For example, the 12 steps, that's based on having a higher power. Not everyone does. What about our atheists? They deserve sobriety. What about the people who feel betrayed by a higher power or religion, and they have this anger towards that? Does that mean they also are not allowed to recover? And it can push people into areas that they're not exactly ready or willing to go yet. I facilitate group meetings at a rehab, and that's one of the biggest things that we face, where some people in the group will be highly religious and kind of trying to pressure other people to be religious or go to a certain type of institution. And I see that resistance from a lot of other people. They instantly stiffen their bodies. And I understand that resistance to a higher power or religion in general. People who have been hurt tend to have some resentment or anger, animosity towards that. And forcing people into that might be just too overwhelming. You don't have to, I don't believe, you don't have to be religious to attend 12-step. I've seen atheists go through 12-step programs and just kind of pick out that part or reassign it in their own minds. But that can be a huge turnoff for some people. Not everything is going to work. Not everyone is going to like everything. And what makes that a little more difficult is our addicts are going to resist addiction, and they're going to try to sway us away from that topic or sway themselves away from it. We don't always know if it works for them or not. But addiction itself is primarily influenced by environment. That's the number one factor. But also mental health, trauma, relationships, levels or access to care, and biology. I say biology last because this one seems to be in the addiction space, seems to be their favorite one to go to. I'm an addict. I was born an addict. I was always going to be one. This is who I am. Kind of, this was my destiny type of talk. And my sister Jenna, when she was alive and in her addiction, she would say that to me. I was always meant to be an addict. I have a disease. I can't change that. Using that as an excuse. I definitely did not like that, but I think people rely too heavily on that factor when really it's your environment, what happened, if there's mental health issues, and also trauma before anything else, like long before anything else. And as we know, within addiction, the recovery process is not a straight line. I wish it was. And addicts who really want to be sober, they also wish it was. However, depending on the substance or type of addiction, those numbers, relapse numbers, about 92, up to 92% of people will relapse within the first year. That's a huge percentage. That's basically everyone. And if you're thinking you're in the 8%, you're wrong. I want us to be real pessimistic about that statistic. I want you to assume your addict is in the majority category, okay? It's extremely rare for someone to get it on the first go. I mean, rare. And with this fluctuation of relapse, there could be needs for care at different levels and different junctions in that process. If someone goes into treatment, they go through the whole program, they get out, and they relapse pretty quickly, they might just need to detox and have a quick little 1-2 month in a program and then get right back out, depending on the circumstances around it. Maybe they need to go full on all over again. But it could be dependent on the cycle or what kind of gaps they need to fill the most. Because that's how I look at it, is when someone relapses, the question is always, what happened? And addicts can sometimes get angry at that question. What do you think happened? I relapsed. Duh. The question is actually, what was the process and where were the gaps? Did you not call your sponsor when you knew you should have? Were you not implementing your coping skills? Were you not connected to your network or community? Were you not working? Were you, not taking care of your mental health? What was the gap? That way, when we have a relapse and go back into treatment, I say, this is what I tell them, hyperfixate on the gap. If your gap was isolation and maybe some of the negative hopelessness in our heads, okay, let's hyperfixate on that. Let's solely address that. If that's the weak point, spend our time there so that when we leave, that's no longer our weak point. And then they just need a little extra sometimes. We want to think of treatment not as the end, but the beginning of a process of stabilization, of learning, rebuilding, establishing. They have to face an immense amount of things in rehab, and you're not going to get it in one shot. That's mostly why I think that the relapse rate is so high is they have to change everything about themselves and their lives. And who the heck is doing that in one shot? I don't think you could. I know I can't. Even if they've gone in and out of rehabs or treatments, it's not pointless. We can, as family, loved ones, we can often feel as though it's a waste of time, a waste of our money, a waste of our hopes. It's not. It's process. And each time they're chipping away at something. Maybe you can't see it. Maybe they can't see it. But they are chipping away at something from the addiction. First thing we're going to look at is detoxing. Detox is short, depending on the substance or behavior of the addiction. Sometimes it also depends on usage, how long they've been using. A lot of that is going to be medically assisted for safety reasons, for time reasons, and for comfort reasons as well. It just helps them to stabilize and to quickly transition into the work that they need to do while in treatment. I will have a separate episode just on detoxing because I got stories for you. We're not going to get too crazy into it on this one, but we want to understand what it is. This is when we're taking our bodies off the substance, or if it's a behavioral addiction, taking our bodies away from those behaviors. And when an addict is in treatment, their withdrawal is managed safely using medications. Their health is monitored. If something happens, they have access to people, or they're supposed to, very easily and quickly. And this reduces a lot of risk that occurs during detox, because there are certain substances where it's dangerous to detox. And as far as time, it could be a few days. It could be a few weeks, especially if we're medically assisted. They're probably going to feel weird for a few weeks. Sometimes they get put on medicine that doesn't always interact well with them, or makes them very sleepy or lethargic or sick to the stomach. So it would depend on that whole journey of getting them on the right medicine and the right dosage, the right timings. But it is relatively quick if you think about it. Very vital for us to understand. Detoxing is not treatment. And if your addict is telling you they detoxed, they're not on substances, they're not using, they're fine, you're being lied to. And they know they're lying to you. It doesn't address the behavior. It doesn't address the roots of the addiction. It doesn't address the patterns of the addiction. All it is taking their bodies off of the substance or away from the behavior. If your addict detoxed, it was probably unintentional. They're having the withdrawal symptoms because they didn't have access to their substances for whatever reason. And not something that they willingly participated in, but they might try to use that to sway you or to get you to shut up about something. And we can feel a little devastated if we've been sold this lie. I've detoxed, I'm off substance, I'm not using, I'm fine. And you might believe that and think that was enough, or that's all that was needed to be done to get this addiction out of here. And then when they relapse or return to their usage, you're going to go through a little spiral because you had hoped it was over. You really thought that it was. And it's not. And that's quite devastating for us. However, detox on its own, great, cool. But that's not enough, and that's not treating the ailment at all. Let's take a look at inpatient. This is typically when your addict goes to a place and they live there for a certain period of time, sometimes 30 days, sometimes 90. It would depend on their program. And it's 24/7 care. It's structured care. It should involve, maybe not always, but therapy. Could be individual, could be group, or combination. There's education about addiction. There should be, but might not always be, mental health support. And I highlight that because we have a separate episode about mental health and addiction because they're closely linked. Sometimes mental health issues are there before the addiction, and sometimes they occur as a result of addiction. But mental health has to be addressed separately from addiction itself. And I think that's why not every rehab or treatment facility is going to have mental health support, but it has to be addressed. There's structured routine, lots of accountability, and it's designed to keep our addicts away from any kind of trigger. They're in this little bubble. They are in rooms or housing together. If they have to go to a separate location, they travel together to the locations. They're going together in groups. They're having lunch together, having break together. It's very regimented, and they're essentially separated from the outside world, which is by design. We have to do that. And maybe for this reason, not everyone is going to be interested in an inpatient facility. I always advocate for it, but it's not always for everyone under every context. But this ensures that their environment is safe. It ensures that they're able to safely detox under supervision. It ensures that any mental health issues, if the facility permits, are treated and addressed. And maybe making sure we have medication for that too. And that limited access to the outside, the regimented lifestyle, the strict rules, it's to help prevent the relapse. Because it's so intense, a lot of people might view it as a form of punishment, which can be used as an asset. And when they're reintegrated into the world, that can be one of the things that they play in their head. If they start having these obsessive thoughts about using, or fantasies or cravings, they can pull that memory back of, oh geez, like I gotta go to this facility, I gotta be under 24/7 watch, I can't leave the area, I can't even go for a walk down the street, I gotta sit in groups all day long, I don't have freedom. It really does kind of suck. And while it is for design, that can be used as an asset for them later on when they're replaying. Is that worth relapsing over? Because then I'm going to have to do that thing all over again. The intensity of inpatient is by design, but it's not a miracle worker. I have seen many people who just sit and waste their time in rehab and just wait for the clock to strike midnight so they can leave and not apply themselves, not participate, not advance, not learn any skills. It's a matter of seizing the opportunity just so we aren't getting anything misconstrued. It's dependent on how much our addicts want to be there and how much they're applying themselves while they're there. And while this type of treatment is so popular and common is because it shows the best results. Step down levels of care, inpatient, then outpatient, then reintegration is shown to have the best results because you're slowly re-entering the world and you're supported as you slowly re-enter. There is that ongoing level of support while you're in the facility. And it's an extreme environmental change. You're going from, some of them are homeless, living on the streets, into this complete different shift of awareness, personal responsibility, help, medicine, lunch, smoke break, things of that nature. We're on a routine. Their environment is completely different, and it's almost like a shock to the system, which really enables them to step into this new identity because it is such a shock. Okay, let's transition to outpatient. Some people, they might get medically assisted detox and maintain an outpatient type of routine, perhaps going in for sessions weekly or doing some sort of check-in system. This is really good if we're having jobs or professional types of careers that we can't necessarily leave fully for whatever reason. We have maybe family responsibilities that we can't just leave. Or this is a little more flexible. Not going to be the best option for everyone, but it's definitely there. And it does cater to a particular types of people. And they can continue to live at home and attend their therapy or support groups, usually weekly therapy, weekly group sessions. There's the education factor around recovery and addiction. There can also be drug testing, which, by the way, is what they do on the inpatient. They're constantly doing drug testing just for that accountability factor. But they might also do that in outpatient as well, depending on the facility. Outpatient is going to be the best option for people who have access to a safe living environment. They have a great deal of motivation and support around treatment and recovery. They have certain responsibilities, like I said, work, family, things of that nature. And they probably are a little more stable in their substance usage, where maybe these are the types of people who can maintain work and family while also using and being in active addiction. Not everyone can do that, but perhaps these types of people can. Loved ones of addicts can sometimes assume that outpatient is not good enough, it's not serious enough, but it's highly effective and really essential for the types of people that appropriately match these types of systems. The next type of treatment we have here is intensive outpatient programs. This is going to be more intense than the category we just talked about, regular outpatient treatment. Intensive outpatient is called IOP, and typically what happens is people will go from inpatient to outpatient. They're still under the same facility, usually. They're still getting that regular support. They're just doing the step down method, and they're graduating out so that they can reintegrate into the world slowly. We don't want it to be overwhelming. How is intensive outpatient structured? Typically, we're going to spend several hours at the facility. Some maybe are going to require morning attendance, and others perhaps evening attendance. It's going to be either every day of the week or most days of the week. And there's still a very strong structure, even though they do have more freedom and they are going to be required to get some type of employment. So they are going to be out into the world and interacting, re-engaging, yet there's still the structure, whether that's through curfew or regular attendance to their groups and their therapy, regular drug testing. There's still going to be this routine and strictness where if you're not being back by your curfew or you're not attending your groups, there's repercussions to that and you could get kicked out. The IOP, intensive outpatient, is going to focus on accountability, reintegration, coping skills, emotional regulation. This is when we get to start applying the skills that we learned at the inpatient. And relapse prevention. We're going to get more practical now that you aren't under these the strictest guidelines and you have a little more leeway. You get to practice your skills and you get to start reintegrating and feeling what that's like. Are we being triggered? Is your job annoying? Are you having a difficult time adjusting or managing your money? This enables them to still have that full support while practically being in the world in a practical sense. Then we have medication-assisted treatment. This is a little bit different. This focuses on getting them some type of medication. There is controversy around this, and I can see both sides of it. I personally know of some people who get on certain types of medications, especially for opioid usage, and they never take themselves off of that medicine. It turns into a lifelong thing. I personally don't consider that sobriety. They're basically just pacifying because they're still medicated and they're still dependent on these medications, which are very strong, by the way. They're not light. It's not like a Tylenol. This is very strong, and sometimes you are getting very high from these medications. It can be tricky and complicated. If we're on this medicine long term, which, let's be honest, a certain organization would love for all of us to be on long term medication, and it's going to be encouraged to be on these medications long term. And it's a pacifier where the people don't have to actually face the issues ever. It gets more complicated, and I have more feelings when people are getting pregnant on these medications. It's like, I got a strong opinion about that, and I don't like it. It's dangerous territory. However, it can be a great tool that we have access to, and the more tools we have, the better. This medication assistance could just be while in a facility, but it might be just that you go get your medicine and leave. It's kind of just kind of in my head, I think of either fast food or drive-through banks where you just get your goods and go. That's like how I tend to think about it. However, it's best if we are combining medication with proper therapy and proper behavioral support. I want you to be aware that medication on its own is not resolving the addiction. The roots are still in the ground and they're thriving whether you see them or not. It's imperative for genuine sobriety that there is therapy and there is behavioral support so that we can transition away from it. But this medication assistance, it does reduce the risk of overdose. It does reduce the risk of withdrawal, which can be dangerous depending on substances. It can improve the treatment retention. It might help people stay there longer as far as treatment options, or encourage them to keep going. And it can lower relapse rates, particularly opioid users. It can be useful for that. And one common misconception is they're replacing one drug with another. And I do agree with that. And some addicts in recovery also battle with that. I'm still technically high on this substance. Am I sober? The best answer that I have in those situations is that we're transitioning and we do what we need to do to transition. Short term, let's do what we gotta do. But as long as we're not making it long term, that's a different story. That's how I think of it in my head. This is not designed long term. This is short term, and we need whatever we can get during that short term to get them stabilized and as comfortable as possible as they transition out of the substance, out of the addiction behavior. It is true that these medicines, they help to stabilize the brain chemistry. They help to reduce cravings. They help to ensure that a person is or able to engage in recovery. It can be used as an asset. It can be used in a different context, but in this context, we want to use it or think of it as an asset as long as it's short term. It's harm reduction, it's stabilization, and it's temporary. The next one we're going to look at is sober living. This is living arrangements that provide substance-free housing, peer accountability, structure, and that gradual independence. Doesn't necessarily mean that we are in a treatment program. These housing situations are private and they could be long-term solutions. They're often peer led. So we might have a house manager who's also in recovery or also graduated from some program or is affiliated with a treatment facility to offer that support and management within the house. We can think of sober living housing as a great environment that facilitates recovery. It's especially helpful for when our typical housing environments are triggering. Maybe we don't even have stable housing. For people who are transitioning out of rehab so that they can get that last kind of trickle of support and network and safety. And also it's for accountability too. People can start taking responsibility for themselves and be accountable for themselves and have their peers there to ensure everyone is taking accountability for themselves. Environment is the number one factor that dictates addiction and also dictates how successful someone is in their recovery. So don't get that twisted. There's no getting out of rehab and going back in the same environment that's chaotic, dysfunctional, and highly triggering. And maybe there's other addicts or substance use in that house. We can never, ever expect someone to be stable and recovered in that environment. Doesn't work that way. So this is a great option for people if that's the type of care that they need. How can you, the loved one, support some type of treatment option? We tend to want to micromanage. We're afraid, we're petrified, really. Death is always an option, it's always on the table, and we are constantly reminded of how risky their life is, how fragile things are, and how we can lose everything in an instant. Of course, we're going to have this tendency, this inclination to micromanage. We're petrified. Yet, I personally cannot be micromanaged. I could not. If you want me to quit a job in 35 seconds, micromanage me. I can be a little spiteful, so do it. And our addicts feel the same way. They don't like being undermined. They don't like feeling as though their responsibility, their personal autonomy is being taken from them. Their power is being removed from them. And you come in trying to manage their lives. They do not like it at all. If you want them to run away from you, try that strategy. It will run very far away from you. And I get the reasoning. We're scared. We're petrified. And we're trying to prevent things from happening. At some point, the training wheels, they have to come off. They come off. And we're there still holding the seat, running alongside that bike. But you're going to have to let go. And you're going to have to stand back and watch and see what happens. Are they going to fall again? Are they going to soar? Are they going to forget how to use their brakes? Are they going to break an arm? I don't know. You don't know. But we're going to have to stand there and watch. And that's how we're going to approach their treatment, supporting them, encouraging them, holding on to that seat, but then letting go. If they fall, if they break their arm, you run and you get them sorted. But as soon as they're sorted, we're getting back on the bike, and I'm right here. I got your seat. And once you have your momentum, I'm letting go again, and we'll see what happens. It's can be frustrating for us, and it feels like this hopeless cycle of falling, getting back up, falling, getting back up. But how do you expect them to get it right if you never give them the chance to do it on their own? If you never let go of the seat, how do you expect them to learn how to ride that bike? That would be crazy to expect them to figure it out on their own or to obtain that skill. This is difficult for us. We might start tracking their appointments, monitoring their mood, maybe even making things more of a deal than they actually are or need to be. We could try to manage the logistics of their life, their treatment, their routine. And we might start policing their recovery. It comes from fear, but it translates into disempowerment. When we're overly involved in their treatment, their recovery, their process, we get burnt out, we get resentful, and we ignore, say it, what do we ignore? That's right, our side. We ignore our side, our journey, our process. And how are you going to be the best version of yourself? How are you going to be supportive and helpful in constructive manners if you're ignoring your side? You can't be. What does healthy support look like, Amanda? Tell me, girl. I'll tell you. It looks like encouragement, not surveillance. Okay, I know we got this obsession with surveillance, cameras, tracking, location. Yeah, there's people who have cameras in their house. If you're one of those people, I don't get you. And I never will. We're obsessed with surveillance. Can you imagine telling an Italian mobster in the 80s or 90s that people willingly enable surveillance inside their homes? They put microphones that are active in their Amazon devices or whatever device, so they don't have to flip a light switch, but that device can record their entire conversations. Those guys would die of a heart attack in that moment, right? The extent that they went to not be recorded. And here we are, opting in. We are going to stop doing that bullshit. Stop surveilling them. Stop tracking their damn location. Stop obsessing about where they are, what they're doing, if they're doing the right thing. It weakens them. You're trying to ease your discomfort, but all you're doing is weakening them, ruining your relationship, and causing yourself an immense amount of stress and strain. That's my surveillance rant for the moment. I have more because I don't like that nonsense, but it also looks like boundaries. Say the B word every time we're on here together. Boundaries. Rather than ultimatums. We're practicing curiosity, not interrogation. You're not the police. You're not CIA, FBI, whatever wannabe thing you're trying to be. You're not it. We're not interrogating them. Even though there's this mistrust, which is why our side is very important, our process, because we have to work through that mistrust. And it's warranted. I'm going to tell you, they have lied to you, manipulated you, broken your heart, stolen from you, took advantage of you. Of course, you don't trust them. But if they're going to expand past those behaviors, if your relationship is going to have any kind of opportunity for a future, we're going to start curiosity rather than the interrogation. And supporting them also looks like what? You supporting you, baby. You supporting yourself. You fixating on your journey and your process. That's how we can show up as the best version of ourselves. Let's look at some common barriers / misconceptions around treatment. If treatment worked, it would have worked the first time. It would have worked the 10th time. It would have worked by now. The majority of people, 92% at least, are going to require more than one stint in rehab. There are some people who get locked in this loop of constant relapse cycles. They'll get clean, they'll do decent, they'll sabotage themselves, relapse, go back to treatment. Get clean, go back out, sabotage, relapse, back into treatment. There are people who will do that for decades. It's exhausting. They just haven't quite figured it out yet. They haven't quite gotten all the roots out yet. They haven't fully committed themselves yet. There's a lot that goes into this. It's not enough to just want it. They just haven't got there yet. And it doesn't mean that they're a failure. The system is a failure. This form of treatment doesn't work for them. This program isn't aligned. It just means that there's more work to do and more commitment to be had. The next misconception / barrier. They don't really want help. I would say most addicts aren't going to be willing or ready for help. Even if they tell you they want help, they'll quickly back away from it when presented the moment to move on it. There are many reasons for that, and it could be that they don't want help, they're afraid, they're not ready. There's a lot connected to that. However, being ambivalent is common. It's not proof of hopelessness or that it'll never work or your loved one has no shot. The circumstances haven't aligned for them yet, or they haven't faced their reality yet, or they haven't had enough consequence yet. They're just not there yet. If I don't push, nothing will happen. Some pressure is necessary when we're looking at the cycle of addiction. The opportune time to set an intervention or get our addicts into rehab is going to be the last stage of the cycle, which is the remorse stage. This is right after they've used or gone on a binge. They feel like a jerk about it. They regret it. They have remorse. This is when they're going to reach out for help. This is when they're going to ask you for help getting them there. This is when they're most likely to accept some sort of intervention or treatment program. We do need to push them during that stage just because they're afraid and there's a lot to it for them. Mostly it's fear, and you do need to push people a little bit during fear. However, pushing people during other stages of the addiction cycle, it's not going to get you anywhere but pushback, resistance, space, disappearance. Most of the time, pushing someone, especially overly pushing them, is not going to get the results that we want. I have to say that you can't dictate when it's time for them to get treatment. We would love to be able to choose. Guess what? You're going today. I don't give a damn what you say or what you think. You're going. If it was an option to drag someone into treatment, like by handcuffs, I would have done it with my sister Jenna. However, it's not an option. They have to voluntarily be there. All this bullshit. They gotta want it. They have to want it because they're the ones who are gonna have to do the work and sit in the discomfort and pull out the roots from their childhood and their trauma. They have to want it enough to invest in that process. And we can't dictate that through pushing them. Pushing at the right moment in the right way, yes. Any other moment, any other way, no. And I told you earlier about my micromanagement feelings. I'm also the same. If you try to push me, that spite will come out. I'm not as spiteful as some people, but I can feel that buck go left. You're like, yeah, fuck you. I'm going right just because you said left, bitch. I was going to go that way, but now I am not. I have to regulate myself on that sometimes, but I feel it. And our addicts also feel that. Stop telling me what to do. Stop dictating my life. Just because you want that, guess what? I'm going to make you suffer, and I'm not going to do what you want. We got to be careful for that. Spite that can surface. And the last one that I have here, choosing the wrong form of treatment will ruin everything. There's so much pressure to be perfect, to figure it all out, to never do anything wrong, to always have the answer, to always respond in the most perfect way. There's a lot of pressure on us to be some kind of superhuman version of ourselves. It's unfair, unrealistic. And it's not that any of this is irreversible, okay? If they go in for a certain type of treatment and figure out it doesn't work for them, no big deal. Let's try something else. You don't like the 12-step? Let's try Dharma. You don't like Dharma? Let's try Smart Recovery. There's other options. You don't like that? Let's try this thing. You don't like inpatient? Okay, cool. Are you open to outpatient? Should we do some kind of medication assisted, and therapy? Let's figure it out. It's not set in stone one way, and if it doesn't work for them, it's a disaster. Part of life is figuring out what works for us and what doesn't. It's the same with addiction and treatment. We just got to try a few things to figure out what's best. And we, as the loved ones, need to be supportive in that and versed in that so we can open them up to the other options that they have. We can explore those options together. We can maybe do the brunt of the work of trying to get them a bed in rehab and just presenting it to them. Nothing is irreversible. As long as they're alive, we have opportunity here. Ultimately, what I want us to think about as it pertains to treatment is this increased capacity. We are stabilizing nervous systems in treatment. We're altering environment so that it supports change and sobriety. We're decreasing shame and guilt and those obsessive thoughts, maybe abusive thoughts that we have. And during treatment, the sense of personal agency expands. They finally get to be responsible for themselves and face things. The meetings that I run at rehab, I run a group there, and sometimes people will share, I'm finally making those doctor's appointments. I'm finally getting my eyes checked or getting this operation that I've been putting off. Their sense of taking care of themselves, having agency over themselves, and handling their business, it expands for them, and they feel very empowered about it. And then, the next week I check in. How was the surgery? How was this? How was that? What happened with the job interview? What are we doing next? This makes them feel powerful. They're realizing that they actually have control over their lives. The addiction has taken that from them. They were never in control. And now they're realizing how powerful they are and what it looks like to care for themselves. And that's a beautiful gift. That also ties into why we don't want to surveil them or interrogate them or micromanage them, because you're taking that back away from them. And that's dangerous. While we can't force them to be ready, it's important that we don't continue to sacrifice ourselves to no end. And even if they're not ready, to verse ourselves in treatment options so that when the moment comes and they are ready, they're in that remorse stage of the addiction cycle, they come to you and they say, I need help, I'm scared. You immediately know what to say. You can immediately pull out some options that you've researched and versed yourself on. You immediately know where some good treatment facilities are nearby or in the next state over. You're already prepared, because if we're waiting to prepare for when that moment arises, guess what? When they tell you, I need help, and you're like, okay, hold on, let me go research, and I'll get back to you in 5 business days. They've already cycled through the remorse stage. They're moving on. They're not going to be open to treatment anymore. They are going to be giving you excuses. They're going to disappear. Your time has lapsed. It's over. You got to wait till the next cycle around and the next remorse stage. That's why I really advocate for getting prepared now, whether they're ready or not. So when they're ready, boom, you jump into action. Let's go right now. I've already done my research. Look at all this stuff I got to show you. What are you thinking? How can we move forward? Understanding these options doesn't mean that we're trying to manage everything. This is how we're being supportive of them, by understanding what the different options are for them. It means that we can ask them better questions. What are you feeling? Okay, you tried 12-step. What were your thoughts on that? Do you want to try it again? Do you want to go to the same place, a different place, different type of treatment? We can be versed and have these questions for them and get their feedback. We can make sure that we're taking realistic responsibility for ourselves, not overextended into our loved one, making sure that we're being supported in our side, and we aren't disappearing into our addicts. We have this understanding that treatment is not a straight shot. It's not going to happen in one go around. We know that. We can manage our expectations a little bit better, knowing our role ensuring we aren't overstepping. That makes for a wonderful environment when our addicts are ready. And when they're ready, oops, gotcha. I love tricking ya. That's all I got for you today. Thanks for being here. I know you have a lot to research and a lot to think about. I hope that we have expanded our understanding a little bit and we're warming up to some things a little bit. We will see you on the next episode. You know we drop every Thursday. So glad to spend time with you. And we'll see you in the next one. Adios, muchachos.